Melinda.
Good afternoon, everybody. We're now live on Blue Table Talk. I'm your host, Debra Jones, and you have to excuse my co-host tonight because she won't be in tonight. But she's thinking about us. So anyway, I'm here, and then we have Dr. Williams with us tonight. But before I introduce Dr. Williams, let me go on and let you know that don't forget, like tomorrow, we usually go to those who line dance. We will not line dance on tomorrow. We'll do the following on the 31st. Also, this month we have two major illnesses out. We have the mental health awareness month, and we also have the stroke awareness month. So tonight we'll talk about stroke. And so with that being said, I have with us tonight Dr. Williams, Dr. Debra Nell Williams, and she's going to be with us as we talk about stroke. So if you have any questions that you would like to present to Dr. Williams, you don't forget to put them on the in the comment section. Ooh, I got all tired tongue. And so and she's more than happy to answer the questions. And so Dr. Williams, how are you tonight? And thank you for coming on Blue Table Talk tonight. Thank you very much.
I'm doing great tonight. I'm glad to be here tonight with you on such an important topic.
Right, but we, tonight there are a lot of people who have had a stroke, and a lot of people really don't want to talk about it, but we're going to just talk to other people about not the benefits, because there's no benefits in the stroke, but we're going to talk to them about how to prevent it and what causes everything. So tonight, tell us a little bit about yourself, Dr. Williams.
Well, I'm a Beaumont girl. I was born and raised in Beaumont, and I came back in Beaumont and had my practice here in Beaumont. And I love Beaumont. I love the people in Beaumont. And one of my goals when I was in practice, and since I've stopped practicing, is to educate the people about being healthy here, because it's all about being healthy. I don't care what you do. I don't care how much money you have, how much money you don't have. If you're not healthy, then it's all for naught. And that's one of my main goals in my life, is to educate people about being healthy. And that's one of the reasons I'm here tonight.
I know you have talked to me a lot of time about my diabetes and stuff like this, but Debra Jones gonna do like Debra Jones do. But I appreciate you. But so since this month is Stroke Awareness Month, how do you identify stroke?
You identify stroke. There's an acronym, FAST. The F stands for the face. If one side of your face is drooping, the A. I'm drawing a blank here.
It's the arm, right?
It's the arm. That's right. You raise your arms. If right. One arm goes down, the S is for your speech, and the T is to call 911 for help. And a stroke. What happens with the stroke is the blood to the area of the brain is blocked. That area of the brain is just like when you're having a heart attack. When the blood to that area is not going there, that area is going to die. And whatever function that area is where the blood stops, that's the area of your body that's going to be affected by the stroke. Or the blood vessel may burst to that area. That's what we call a hemorrhagic stroke, where the blood gets into the brain. There are several kinds of stroke. One is ischemic stroke. That's the one where a blood clot will block off that area to the brain. The hemorrhagic stroke, that's the one where the blood vessel will burst and you will get blood in the brain. That's one where people will say he had an aneurysm, and then the aneurysm will rupture and cause problems. Then there's a TIA, a transient ischemic attack, where the person will have a stroke and will have a symptoms of the stroke, and they may be paralyzed partially, and it will only be for a specified time. They will not have it permanently. That's why it's called transient. It will come and then it will go away. It may last minutes, it may last hours, but the main thing about this kind of stroke is that it will go away.
Mm-hmm.
And some of the symptoms the person may get when they have a stroke is the face may droop, as I said, the arm may get weak. That's the A. The speech may get difficult, and then there's a time to call 911 for the person. That's the FAST. Other symptoms, they may get numb or weak. It can happen in the face. It can happen in the arms. It can happen in the legs. The person may get somewhat confused. They may have trouble. You may have trouble understanding them. You may have seen when the person was on the news, giving the news report, and the people started calling into the news station because they couldn't understand what the lady was saying. She was having a stroke on the air because her speech got all garbled. Sometimes you may have difficulty seeing in one eye, both eyes, and the person may get dizzy. If you're walking, you may lose balance. You may have a problem with your coordination, or you may get a severe headache, especially if you have the hemorrhagic stroke. The person may have, I'm having the worst headache I ever had in my life, and you may, if you may be by yourself and you have any of these symptoms, you may, if you think you're having a stroke, call 911. Don't sit and wait, and think it may go away. Call 911 because it's a life-threatening condition for you. And the thing about a stroke is you have a window of opportunity where you can get help and get this TPA they can give you if you get to the hospital within 3 to 4 hours. They can give you, and sometimes your problem can be helped, and you may have reversal of some of the signs that you have when you get to the hospital if you can get this drug within that period of time. And if they can get you the golden hour, get you there within an hour, start working on you, you can also have a chance of getting better and doing better than if you get there later and wait. Then there's some risk factors associated with the stroke. Diabetes affects a lot of things. High blood pressure. If you have those diseases, then you are at increased risk of having a stroke. There's a heart arrhythmia called atrial fibrillation. That's associated with a stroke because it's an irregular heartbeat. Sometimes it'll cause you to have clots, and those clots can cause the artery to be blocked, and that can cause you to have a stroke. Having high cholesterol, cholesterol is one of those fats, and that can cause you to have blockage in the arteries. People with sickle cell anemia, they are at increased risk to have strokes. Carotid artery disease, the carotids are the arteries, the big arteries of the neck, and sometimes those will get clogged with plaque, and they can cause you to have a stroke too. It sounds like it's when you get a stroke, people are so afraid of being dependent on people, especially really independent people. They don't want anybody to have to take care of them, and they're so fearful of having a stroke. But there are some things that you can do in your life to try to not have to get a stroke, and those are lifestyle things you can do. The risk factors in your lifestyle that put you at increased risk of having a stroke. One of those things is poor diet and nutrition, eating a high-fat diet, high carbohydrate diet, a lot of sodium in your diet, that's salt in your diet, not getting enough physical activity. Exercise, it affects everything. Smoking affects a lot of things. A lot of alcohol use also affects this. And as we get older, people who have strokes, the majority of the people are 65 or older. So young people can have strokes, but Bailey is in ages 65 or older. And for each decade that you get, the incident nearly doubles over the age of 55. And also race plays a part. African Americans have a greater risk of stroke than Caucasian. Women experience more strokes than men. And having a stroke, heart attack, or TIA, the stroke, the transient ischemic attack that I said may last for minutes or last for hours, that increases your chance of having another stroke. Some people will breathe a sigh of relief when they get that transient stroke and say, oh, I got lucky. That only means that that's a warning. That means that you can have a stroke down the line. So that doesn't mean that you got off. You were lucky. You don't have any danger. That's just a warning to you that you are at increased risk of having a real stroke. Uh, and there are some things that you can do uh, to try to prevent yourself from having a stroke. One thing is, diabetes puts you at increased risk. High blood pressure puts you at increased risk. So you can manage your diabetes. Take your blood sugar. Uh, a blood sugar that's high is not to tell you you're being a bad person. It lets you know what you need to do. If it's high, that means you need to uh, pay attention to what you're eating. Do more physical activity. It's not saying you're a bad person. Check your blood pressure. Work with your doctor to get you on the right medication. Make sure you pay attention to the amount of salt that you're eating. We eat too much salt. Uh, for the full day, you shouldn't eat any more than less than a teaspoon of salt for the whole day. And we put that in one meal a lot of times. uh, and lower your eat more fish instead of red meat. Uh, Eat foods that have low amount of added sugar. Eat more vegetables. Eat more beans. Eat more grains, nuts, especially almonds, uh, and eat more whole grains. And I can't say enough about physical activity. If we can do 30 minutes of exercise at least 5 days a week, that's a good thing. Um, and moving your body is very good. And try not to smoke. If you're smoking, try to smoke less. It's very hard to stop smoking, but any improvement is a good thing. Limit how much alcohol you drink. Alcohol affects the heart, uh, and so try to limit that. And take your medications that's prescribed. People think sometimes that when they get started on medication, when everything improves, then they think they're okay. They don't have to take it anymore. But it improved because you were taking the medication. So you need to take your medication unless your doctor takes you off of the medication.
I know that the doctor uh, generally puts a diabetic person on aspirin, take 81 milligram, to prevent
Hmm.
stroke, stuff like that.
Because aspirin helps you not to develop blood clots.
Blood
That's
clots.
one reason they do that. Yes.
Right.
Hmm.
I remember as well, Doc, that my husband had a stroke.
Hmm.
Um, and I remember very well that he had called, he was in the bedroom. And so he had called me to come in the bedroom was just saying, help, come, help me. And I'm like, help you. And so, cause I was in the kitchen, not cooking. I don't know what I was in the kitchen.
Uh huh.
And so I ran back there to the bedroom. And so he had a hamburger at that time. And so, he couldn't pick it up. And
Yeah.
I'm like, what's wrong? And so he said, I can't lift this hamburger. And I didn't think of stroke because number one, he never took medication.
Yeah.
I took all the medication.
Hmm.
Number two, he was very active in what he was in his work and everything. And so I'm like, what's going on? So I cut the hamburger for him and I gave it to him and he still dropped it. And that time I knew something was going on. And
Right.
so I did call 911 and that's when they told me he had a stroke.
Yeah.
But they did treat him. I mean, had him in the hospital for a while, and then after that, he was released, and he came home for a couple of days, and then he had another stroke.
Yeah.
And so my question is, once a person have a stroke, do they continuously have strokes or what?
Some people will have a stroke and will have another stroke. It doesn't happen all the time, but it does happen sometimes.
Mm-hmm.
Uh, most people will have a stroke, and depending on the severity of the stroke, they will either have a recovery within a week, 2 weeks, and they go in their rehab. But some people, it will take weeks to months to years, depending on the severity of the stroke. But some people will have a stroke, and even in the hospital, like what happened with your husband, while they're in the hospital, within a day or so of that original stroke, they will have another stroke.
Mm.
Right, that will happen sometimes.
And then
Yeah.
when he came home, they asked, they wanted him to do exercise, like with weights, and
Yeah.
kept, kept lifting him up and everything. And then I stepped. I mean, he was fine. I stepped out of the room, and came back in, and that's when he had this. But as soon as I stepped out, he had another stroke.
Another stroke.
Yeah,
Yeah.
and so then we had called 911 again to come pick him up. But he wasn't. He didn't get any paralysis or anything like that. It was just like, I guess his brain was just, I don't know. His
And you never know if he had had warning signs before the
right.
stroke, because you can have things like being a little off balance. You may have had some dizziness. It may have been some things where he may have had a little, a little loss of memory, a little problems with his cognition, where he may have forgotten something, may have been a little something different with his memory. You never know, some little signs that you may have thought, brushed him off and say, "Oh, it's nothing." Before before he had the stroke, some little warning signs that it may have been happening that we just don't pay attention to because we're just too busy and we think it's really nothing to worry about.
So how long does it take? Do you know the maximum it takes to recover from a stroke?
I can't tell you. It just depends on,
The
as I
patient.
said, how the patient, how severe the stroke was.
Um,
Yeah.
and a lot of time they do or they don't have paralysis.
Again, it depends on the stroke. Some people will present with paralysis, but after they have rehab, uh, then the paralysis will go away and they'll do okay. But some people will present with paralysis and they will remain paralyzed for the rest of their life. It all depends. And some will get a little of their movement back,
Mm-hmm.
uh, and but will not get 100% of their movement back.
So
It
so
just all depends.
are strokes hereditary? Because I know that his brother had several strokes,
Yeah.
and
Now, strokes seem to run in families, but the genetic tendency for the risk factors for a stroke, like diabetes and high blood pressure, uh, is what that connection is, and because families tend to say eat the same and have some of those same diseases like diabetes and high blood pressure, that makes it seem like it tends to run in the family, but it's just that they have some of those same risk factors going on. But to say the stroke itself runs in the families, I can't say.
right. So let me talk to my audience for a minute. They're coming on
Okay.
now. And so thank you guys for joining Blue Table Talk tonight. I appreciate you guys. Don't forget to hit that share button and share that Dr. Williams is on tonight. And this is Stroke Awareness Month, along with Mental Illness Month. But tonight we're talking about the stroke. And so Yolanda Adams, I'm so sorry, Yolanda Avery, she got the A in her name. So those warning signs are something to notice.
Yes.
And,
Yes.
yeah, as Stacey Green says, is it true that you should take or give a person having a stroke a baby aspirin? Yes, we just
Yes. Uh-huh.
do you give that person the aspirin while they're having a stroke, or do you give that person an aspirin, or do they just start taking aspirins and stop? How you do?
Usually a person who's at risk, they're on the baby aspirin already. Uh, and sometimes, yes. Uh, there's a controversy now, you probably heard of it, that they're saying now not to even give baby aspirin anymore, especially in older people because of the risk of bleeding. And they'll say don't give baby aspirin. A lot of doctors are continuing to recommend the patients still take the 81 milligrams of baby aspirin, such a small dose of the baby aspirin. Yeah.
Right. Because I know when I go to the doctor's office, because I take the 81 milligram, I know when I go to the doctor's office, they say, "Are you still taking your aspirin?" Yeah.
Yeah.
You know.
Yeah.
So Yolanda Avery once says, are there any tests that can be taken to check blockages before something happens that insurance will cover?
Yes. Especially in older people. And in fact, on an exam, when you go to the doctor, the doctor will take the stethoscope and put it along your neck and listen in your neck. They'll listen to the carotid artery that's on both sides. They're looking for any sounds in the neck that may indicate that there are some blockages in there. And they will send you for a carotid ultrasound that the insurances will pay for. And those ultrasounds will let them know if you have any blockages in your neck. And insurance will pay for that.
So that blockage will cause a stroke?
Yeah, because look at those carotid arteries in your neck going up to your brain, And just imagine if there's a blockage in that artery going up to your brain, if that gets blocked, you're definitely going to have some problems because that's supplying, going up to your brain on both sides there. And if that gets blocked, you're definitely going to have some problems.
Right.
So that's what they will. You see some people will have those big cuts,
the cuts, right?
On your neck. That's what that is. They're going in there and they clean out that artery. Because if that artery blocked, you're going to have a major stroke. Because that's a big artery going up there.
Wow.
Supplying the brain.
That's on both sides, right?
You have one on each side, left and right carotid.
So do they have surgery on that or what?
Yeah, they have surgery. Yes. Yes.
Wow.
And the insurance company will pay for that. But that's what they're doing when they take their stethoscope and listen to your neck. They listen to that carotid artery to see if there's anything that indicates there's some blockage there.
I know you were talking about diabetes and the carotid
high blood pressure,
everything like that could cause a stroke. What about stress?
Stress in a indirect way, because stress can cause your blood pressure to go up, it cause your heart rate to go up. It releases cortisol, which is a hormone, and in that way it can indirectly cause clots to develop. With the word clot coming in, and you can cause the clots to get in those blood vessels, right, and cause a blockage. So in an indirect way.
So, Doc, let me ask you a question. Strokes and aneurysm, are they almost the same? Are they related?
Well, aneurysm can cause a stroke because it ruptures, and so the blood is going into the brain. If it's going out into the brain, it's not getting to the tissues like it should. Right. So that's how it causes a stroke. Yeah.
Wow. That's something, okay, so when I'm going back to my husband, because like I said, I never had a stroke, but I know he had one, and I took care of him from February to June when he passed away. So I was there at every second, at every call. So he, how is it that when a person has a stroke, they tend to get mean, and I mean, just
angry,
angry and stuff like that. And I mean, I put up with it because I know he was ill.
Yeah. So, and that illness has something to do with it. But sometimes strokes, especially in their frontal area, they affect that area, and so they'll have these outbursts, involuntary outbursts of crying and anger and yelling and emotional outbursts sometimes, because it affected that part of the brain, and they can't control it, and that may be a part of it. And then part of it could be the frustration of not being able do what he did before, and just being chronically ill like that could be also part of it.
Because I know he would just fuss, and then after he get through fuss, he said, "Okay, honey, I love you." I'm like, "What?"
Yeah.
But I you have to put up with it because you know that they're ill. Yeah. That's number one, right. And you know that it's really not that person.
Yeah.
So wow, yeah. Can young people? How young can young people have a stroke? And if so, how young can they be?
Well, young people can have a stroke, and as I said, sickle cell anemia is a risk factor for stroke. So I've seen very young toddlers and have stroke with sickle cell anemia because the sickle cells block the arteries. So they're that young.
Wow.
So so it's no age. It's no age
for a stroke.
Different though.
Yeah. Okay. TIA. Explain that to me.
The transient ischemic attack. You may have a clot that will get there, and it will move itself. It will be there for a while, and after a while, the clot will itself move. Okay, it's not big enough to stay there itself, for instance, say, and it may just for some reason it may unlarge itself, so it'll move on. So that stroke will is not a permanent one. The person will get their function back because that opening has that area has reopened again, and so that person gets a blessing for that time. that it goes on and moves on, and so they get their function back. But it's a warning that something's going on in your body. Well, you may not get that chance again. The next time it happens, then it's going to stay there, and you may have a full-fledged stroke.
So you could get several TIA, have several TIAs or what?
Oh, you can have several TIAs, yes.
Wow.
Oh yeah. You can have several warnings, but that's a warning to get yourself in order to do those things I mentioned that you can do to try to prevent having a stroke, or start doing that. And those kind of people, the doctor probably would put on some medicines that would cause your blood to be blood thinners, things like Plavix, that would do that.
Right.
Yeah.
Because I was wondering about the treatment, what they put you on and stuff like that.
Yeah, they put you on blood thinners.
Yeah. So the blood thinner is to
prevent clots from forming.
Okay.
Yeah, prevent clots. Something stronger than aspirin. They'll prevent clots from forming.
Because I can say aspirin is a blood thinner, right?
Right, but it's a mild one. It's not like the strong ones. Yeah.
You said now that they're talking about taking people off of aspirin.
Yeah, they've been talking about that, taking them off of that. But as I said, a lot of doctors are keeping patients on it. So.
Right. Well, the guy that my doctor give me on, he said get off of it. So what about people? Because so I have a girlfriend. They were at a meeting, one of our class meetings, and so one of the ladies at the meeting, she was talking, and then all of a sudden they said the eyes on the back of the head, and she just had a stroke at the meeting. Mm-hmm. And so does that of course they call 911 because some of them knew what was going on. So with that, it has affected her memory and it has affected her speech.
Mm-hmm.
So is that normal?
Yeah, it can do that. That's the area where she had her stroke at, affected those areas. Because some people have a stroke and their talking is fine. They're just affected in the arm or leg, say. It depends on the area. The area where you had the stroke will be the area you'll notice where their weakness is where they had the area of the brain they had the stroke at. So because some people have a stroke and they'll talk to you just fine, but their problem is weakness in the arm, or weakness in the leg, or weakness in both. Then others will have the problem with the speech.
The speech, right?
Yes. Yeah.
So you had a stroke on your left side. Will your right side be affected or the left side?
If you had the stroke on the right side of the brain, then you're probably going to be on the left side of the brain. It crosses. If your problem's on the left side, it's going to be on the right side.
Well, why is that?
Because the brain in the brain, right in the middle of the brain, everything crosses. Yeah, it crosses over.
Wow.
That's just the way God made it.
Why stroke survivors have seizures? Why do they have seizures after they have the stroke?
Because that part of the brain is irritated and it's irritable, and it's an area where you have seizures, that's an area of the brain that's irritated and it's irritable, and so you have seizures there.
Right. Me being the caretaker of my husband, a lot of times I wonder, how can I keep this patient motivated? And so what are some things that I should have done, or even if I see a friend of mine that had how to keep that person motivated?
Well, one thing is be patient with them and make sure they have a routine, something that they expect, they have a routine so they know what to expect every day. Nothing new is put on them, and let them know that this is how it is now, but one day it's going to be better. You're doing all of this to knowing that one day it is going to get better. And when they have the outbursts like they were having, the depression which comes in having a stroke, a lot of patients get depressed. Let them know that that's okay. And address those emotional outbursts and things like that. Let them know that that's okay. And that I don't know how I would react to this situation. And you're doing good. You're doing good. I'm proud of you. I'm here for you. I'm going to be here for you, you know, and and set achievable goals, you
right,
know, because it's a hard thing. It's hard to give you independence, you
right,
know, and it's frustrating. It's just support,
right.
and you probably were doing all of that.
I was doing that because I was still working. Everybody that know me know I like to clown around. So when
Yeah,
he was in there. In the morning time, I had to sleep there at night because he ain't gonna let me go home. That was number one. I,
yeah.
I slept at the hospital at night. Went up, got up 5 o'clock in the morning, ran home, took a shower, came back to feed him before I went to work. And then after that, I bathed him, I fed him, and went to work. On my lunch time, went back over there to check on him. Then in the evening, I was there. But I used to stand there and I dance in front of him, and he would just look at me like, "The hell are you doing?" But
Oh,
he knew that I was trying to get him to together. But
yeah, yeah.
so what Agent Arsenault says, my mom is a 2-time stroke survivor. Hey, great, Agent.
That's a blessing. Yes,
Yeah.
that is a blessing. Yes.
Okay, so we talked about having strokes and having them back to back. So what if a patient had a stroke and then all of a sudden they just got completely they completely recovered from them.
Uh
And later
huh.
on down the line, they had another stroke
Okay.
within a year. What do we continue doing the same thing that we did in the beginning?
Same. That's right. That's right.
Wow. Wow.
Yep.
I know
And
a lot.
hopefully something has come up in the treatment, you know, that you can use uh, with that person, you know,
Mhm.
because some things are always things are always being produced and new treatments, uh, new rehab things that they're using, and to make the treatment better.
Right. Right. So what is a normal lifespan for a patient who had a stroke?
Um, Again, it depends on the severity of the stroke. People who have full recoveries, they tend to do well, but people who have severe strokes, uh, the lifespan, the lifespan in general for just in general for people who have strokes overall, it can be like about 10 years, 10 years.
Wow.
But the ones who as I said, who have full recovery, it's going to be longer than that.
Right.
But just overall, was about 10 years.
Yeah. My like I said, I noticed his illness in February and June he passed away. So he just now a lot of people told me after he passed away, they would ask me how did he pass away, and I said he had a stroke, and they would say he must have had something else because you can't die from a stroke. Can you?
Yes, you can die from a stroke.
And did he have something else that caused it or whatever, something like that?
Well, some people, the stroke is the only illness they have, but uh, uh, but usually people with stroke, again, you know, they usually have some other illness, diabetes, high blood pressure,
Right,
heart disease.
right,
Yeah, usually they have some other underlying illness, but the stroke itself can be the thing that you die from.
right, right. And like I said, he had never taken any medication like for diabetes or anything like that.
Hmm.
I, I mean, you go in my cabinet, see anything you need. I got it.
Yeah,
But he did exercise. Like I said, he was strong as a mule.
yeah.
But then
That,
when they had that stroke, I guess because he had that stroke and he couldn't do the things he did, you know, it
so it
just
has to be super frustrated for him.
yeah, it was super
It really did.
frustrating.
Yeah, and yeah.
Yeah. Yolanda says my husband is a 30-plus-year aneurysm survivor.
Wow,
Wow,
wow.
wow.
That's amazing.
Yes,
Because people with aneurysm, I mean, to 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 get to the hospital is amazing. And once you get there, you know, and able to survive is amazing. So people with aneurysm are the class by themselves. That's one.
And you say they are related, right?
Well, the aneurysm can cause a stroke.
And risk could cause a
It's
stroke.
it's called a hemorrhagic stroke.
Right.
Yeah.
Can you go back and tell, because a lot of people who just came on the types of strokes?
Okay. Ischemic stroke is the kind of stroke. It's the most common kind. It's the kind when the artery is blocked because of a clot. The artery already may have some plaque in it, and then a clot comes in and it seals off the space that the artery had in left where the plaque is. It'll just seal it off there, and it's totally blocked, so the
Mm-hmm.
blood is not getting to the brain. Hemorrhagic stroke is when the artery bursts and the blood it just goes all out, and
Mm-hmm.
the tissue is not getting the blood that it needs. A transient ischemic attack, or TIA, is what happens when there's a temporary blockage of the blood to the tissue. And
Mm-hmm.
it can last minutes or it can last hours, but it's reversible. The clot will move on and the person will get their function back. And that one is a warning that there's something going on in the body that needs to be addressed, uh, or a stroke is imminent.
Mm-hmm.
Yeah.
And let them also know how to identify the four the acronym for it.
It's fast. It's face, uh, any drooping in your face. A is for your arms. Spread your arms out. If one kind of droops down, then that means that it's a weakness in one of those arms. S is for your speech. If there's any garbling of the speech, and T is to tell someone to call 911 because that person is possibly having a stroke and needs to be attended to.
So do they have to have all four of those or what? Because I know I don't remember his face drooping or anything like that.
Yeah.
I don't remember that. I mean, it probably did. I didn't notice it. But do they have to have all four of them in order for you to know that that's a sign of a stroke?
Probably not all four, but
Most of it.
I think most of those. But um, I would say, if somebody's speech is garbled, you can understand. That's enough for me.
Mm-hmm.
To go and get some help.
Mm-hmm.
Like I said, the woman who was on television giving the news, she was speaking and they couldn't understand her at all, and everybody was calling in to get help. And if someone is with you and all of a sudden they can't move an arm or something, that's enough to get some help. Also, but that combination of things for sure, you're gonna get some help. If someone face all of a sudden starts uh, drooping on you, and they can't move that side of their face, and that you should get some help for that person for sure.
And that will tell you what side the stroke is on when their face starts drooping, right?
Right. All the side of that body, all that's happening, then that's the side that stroke is on.
And then, like you said, it would affect the opposite side.
Right.
Right.
It's going to be the signs are going to be on one side, and the area of the brain the stroke is happening is going to be on the opposite side.
Okay. Well, another thing, because I want to know this: what the food that we are to eat to prevent a stroke. I know vegetables got to be one of them.
Right. You want to eat foods that are. You want to make sure you're going to lower your intake of fats, salt. You want to lower your intake of carbohydrates, sugars, starches. Make sure you monitor those. Eat more vegetables. You want to eat more grains, dried beans. All those things are very healthy for you.
Yeah.
And also fried foods, limit fried foods, bake, broil, grill your meats, and try to get lean meat, low fat content in meats.
No red meat.
Huh?
No red meat.
Well, limit red meat. And if you're going to eat red meat, again, lean red meat.
That's almost like having diabetes.
Well, it's just that everybody should eat like people with diabetes,
That's everything you just named. That's what my doctor tell me all the time. So that's just like having diabetes.
Yeah.
So I asked you why the patient is angry all the time. Well, not all the time, but always angry. Why do they scream so much? I mean, he was screaming. I'm like, what the heck?
Well, I told you sometimes that area of the brain where they have this it's an involuntary emotional outburst they'll have, yelling, because that area of the brain that controls the emotions, they just they can't control that area. And it could be because of that, you know. And if not, it just could be just again something with his the way he's handling the problem. But they will have this frontal area there. They have a lot of emotional outbursts.
Adrian also says my mom had intracranial
It's
hemorrhage on the
on the
right
right
side
side.
of her brain.
Yeah, yeah.
Is that another sign of
That's bleeding in the brain.
bleeding in the brain?
Uh-huh.
So really, the aneurysm and the stroke, they have the same symptoms. Same,
Well, the aneurysm caused the stroke.
right?
Uh-huh.
Because they're bleeding in the brain as well.
That's
Right?
bleeding in the brain. And it's bleeding in the brain.
Wow.
Anything that causes bleeding in the brain. And the intracranial hemorrhage came from some bleeding in the brain from a blood vessel that was broken.
It was broken.
Mm-hmm.
Wow. And I know, and going back to my husband, because like I said, I was there from A to Z. He had blood clots in his legs, so
Okay.
the doctor had surgery and to stop the blood clot. Is that that's what it is?
He did what?
The doctor had surgery on his legs so he could stop the blood clot.
Mm-hmm.
And so I guess he didn't have blood clots anymore, or what? Because blood clots, they run fast. I mean, once you hear somebody have blood clots, they're moving fast. So that made me feel good because that blood clot didn't reach the brain part.
Yeah.
They stopped it. So do stroke victims always have blood clots?
No, not always. There's a cryptogenic stroke, and it's called that because it's a stroke of unknown origin. They don't know where the stroke came from.
Mm-hmm.
And so they don't know they don't know where the stroke comes from.
Mm-hmm.
So, but well, let me change it. The stroke is going to either be from a clot or a bleed. Let me reverse that. So it's going to always be a clot or a bleed. The cryptogenic stroke I was going to talk about, it comes from atrial fib, they think, or some other thing, but they can't determine where it comes from.
So can you recover from a stroke?
Fully? Yeah, some people recover fully. Some people recover fully. You say you see people, you'll say, they say, yeah, I had a stroke, and you say, well, I can't tell.
Right.
I can't tell you had a stroke, and you really can't. They walk just fine. They do anything they want. The speech is fine. You can't tell anything that they had a stroke at all. And there's some people who had a stroke, and it's something a little bit about their speech you tell is different, or it may be that the walk is a little different, but they're fine. But it's something a little bit different about their gait, or maybe or the way they pick something up or whatever. But some people will recover fully, and you can't tell anything. If they hadn't told you, you wouldn't have known.
Okay, so I have a girlfriend who had a stroke, and so I guess you could say she recovered from it and everything. But she was sitting in an event. I mean, we having fun and everything, and all of a sudden she just burst out crying, and she don't know why she was crying. She just started crying, and I'm like, "Are you okay? And do you need anything?" Or I don't know what's wrong. Is that coming from the stroke? that she had, or what?
Yeah, that emotional outburst
Yeah.
like that. Yeah, yeah.
Wow. So how? So I
So
mean,
what happened with her?
it doesn't. Well, this was happening. She was walking one day. She was taking her walk and everything, and then she went home after she got through. After she finished her exercise, she went home, and then all of a sudden she passed out on the floor. Didn't know what happened. She was talking to her niece and everything, and then her niece said, "Annie, your speech is kind of slurred. What's going on?" And so she said, "I don't know." And then she had another sister in the room, and so all of a sudden she just passed out on the floor. Now they called her niece called the sister, another sister, and told her to go get the sister and tell her go check on her. But she was on the floor naked. She was getting ready to take a shower, and so they
And
rushed her to
nobody called 911.
yeah, they called 911. But how long does it take for that brain?
See
It's
that golden hour I told you about was like an hour to get them get them help, get them there in an hour, let them start working on them, and then to get that TPA is like 3 to 4 hours to get that medication in that to try to reverse everything that clot in agent, an anti-clotting agent. Yeah.
but isn't it known a known fact that you only have a couple of minutes before that brain start
No,
dissipate or some whatever.
no, you have that. You have that. That's your timeline right there. To get you, main thing you want to get is get that medication to try to reverse everything, and that's that 3 to 4 hour period you have to get that TPA clotting agent in there.
Mm-hmm.
Yeah, but you want to get in the hospital as soon as possible.
As soon as possible.
Always for any kind of emergency like that, as soon
Wow.
as possible.
Yeah. I mean, she just it blew all of us away, because she was found on the floor and she was just out exercising, and I know that it was hot that day as well, and so you walk outside, not in the mall or anywhere. We was just walking outside, and
Yeah,
um, of course she didn't have anything on her head, and that was another thing. I used to fuss at my husband when he go out and mow the yard and everything, and then he didn't have anything on my head. You got to have something on their head, right?
when it's hot
Because
out there.
it's hot out there.
Yes,
Yeah,
you got to protect yourself.
you got to protect. You got. I mean, we up in age, and he was up in age then. So, but you have to. She didn't have anything on her head, and then she went on home, and I guess she thought she was fine, and wasn't. And now she really takes it easy because I actually do a lot of things and she won't do it. She just won't do it.
Yeah.
You know. So,
Wow.
and you know me, I like to exercise. I like to dance, and I'll be telling her, come dance with me and come to. She won't do it. She says she's not ready for it right now. And I guess you have to leave. I guess you have to give people time, to make up their mind. But
That's right.
shouldn't
But
people
that
like
was
that
that was
exercise?
traumatic. That was
Yeah,
traumatic. Yeah.
yeah, but still, do they need to exercise anything?
You mean after her stroke and everything?
I mean,
Yeah.
yeah,
Yeah. Once she gets her clearance, yes. You know, she has exercises she can do. Part of her rehab. That's part of her rehab too.
right. But not just walking in like in the sun. I wouldn't dare ask her to
No,
come out.
when she finishes her rehab, they'll tell her exactly what she can do.
Right,
Because again, everybody has a different level of what they can do depending on what their situation is with the stroke they had. How much damage the stroke did and where they are, and their therapist will let them know what they can do.
right.
You know, so
I
but
know. Go ahead. I'm
it's
sorry.
it's 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 a traumatizing experience because if you are very independent,
Hmm.
it's a big change for you where people have to do things for you for a period of time and maybe for a long period of time, if you have a severe stroke, and that's very traumatizing.
How can
So
a stroke patient reduce spasticity? How can they reduce that?
Reduce what?
What's that word? Spasticity? Spatics?
Spec- oh, spasticity.
Yeah.
Yes. Well, of course, with therapy and to move that area as much as possible. Exercise it. And they have some. What do I want to say? Oh, what am I want to say? Um, what are those things called? Um, the mobility tools they use. That they use with them. Uh, oh shoot.
Like those iron things you use.
Yeah, they could put on there. They put on there, and they to use to help them move their arms and stuff.
Right,
Those
right.
kind of things. Yes,
Mhm.
yes.
Yeah.
Yeah. The main thing is keep it moving. The main thing is to keep it moving. You know. Um, but that's a big problem for some people. Really big problem for some people. The main thing is to exercise and keep stretching them.
Right.
Um, get with a good therapist.
Yeah.
Yeah. Yeah.
Terry Ross says, I had a friend of mine and he says, hello, Dr. Williams. He says, I had a friend of mine who suffered a stroke and he often stumbled on flat surfaces. Is that a prelude to a stroke?
Yeah. Sometimes having trouble with balance can be a prelude to it. Problem with coordination, that could be a prelude to it. Um, because you have trouble with muscle movement, also could be a prelude to a stroke. Yeah.
Wow. We just need to watch one another and see what
That's right. Whenever there's a change in somebody, whenever there's a change, and sometimes you'll notice before they will, because we tend to shrug things off and say,
Right.
"Oh, that's nothing," Sometimes your friend will notice it before you will.
Right. Angie, we just asked this question, but I'm gonna give it to Doc anyway. She said, "Excuse me, is strokes hereditary?" So my mom's grandmother died from a stroke, and her mother died from a stroke.
Yeah, I said earlier, it seems to run in families, but it may have a genetic tendency for the risk factors for the stroke, like the diabetes and the high blood pressure. Uh, those risk factors is usually what's common, and because they're the risk factors for the stroke, it makes the stroke seem to run in families because they're all interrelated.
Right.
Yeah.
So you're saying that it skip a generation, like my grandmother, then skip my mom, and then it comes to the children, or
I
does it?
don't think I don't think that I don't think so. I think it just didn't happen then. I don't kind of believe in skipping generations like
Okay.
that. Yeah.
And you don't believe in just with a stroke or just with anything?
Or anything. I just think it just doesn't happen.
It just doesn't happen.
Yeah.
Right. Oh, that's really scary though. It really is.
Yeah. That's why we have to know our family history. It's so important to know our family history.
Right.
Because if you do, you can start working on things with the children while they're young, including including their nutrition and activity. Start them young, you know, get them used to eating certain foods, before they start saying they don't like it,
Right.
put it in their diet, get them in the move when they're young, so they'll get physical activity in their normal routine before they have a chance to say they don't like it.
Right. Young people right now, they don't they don't do physical activity. They too busy with the games on
Yeah.
and everything. So the computers and everything. So back in the day, we went outside.
Oh yeah.
We played outside.
That's right.
Yeah, we had to come in when light came on, and so when light came on, we had to be announced. But we did all the outside activities, and so, but I mean, not to say that it stopped us from having this illness or anything like that, but that's what we did with the children. Now they don't do that.
Yeah.
So Terry says, I was working with this guy who was suffering a stroke, and he was reading and writing things that had nothing to do with the job. He had no clue he was suffering a stroke.
Right. Yep. Yep.
But y'all know Terry. Yeah. Go ahead.
It messes with your cognition,
Mm,
with your mind. It messes with your mind. You'll say things that have nothing to do with it, like you said, he was writing. It messes with your memory. You have memory loss. All of that will.
yeah. Wow. So we getting ready to close out. So before we close out, Dr. Williams, tell us those who just not coming on the how how to identify a stroke and the treatment, and just tell us a little bit about strokes and what we should be looking for.
Okay. Well, um, again, a stroke is just a loss of blood supply to the uh, the brain, and when that happens, then the brain dies, and whichever area is involved is the area you will see what this person is having the resulting weakness in their body from the stroke. And the way you can observe someone or in yourself that you're having a stroke is to use the acronym FAST: facial drooping, arm weakness, speech difficulty, and it's time to call 911. And symptoms: numbness or weakness in the face and the arms, confusion, trouble understanding the speech, uh, difficulty seeing rather, dizziness, loss of coordination, trouble walking with that. You may get a severe headache if there's a problem with blood vessel bursting with an aneurysm, for example. Some of the risk factors are diabetes, high blood pressure, atrial fibrillation, which is an irregular rhythm in the heart, high cholesterol, sickle cell anemia, circulation problem, and carotid arteries. The carotid arteries are the big blood vessels in the neck. Um, there are several kinds of stroke. Ischemic stroke, that's when there's a loss of blood supply because of a clot. Hemorrhagic stroke, that's when the loss of blood supply to the tissue because the blood vessel has burst. And a transient ischemic attack, which is a TIA, meaning that you had the symptoms of a stroke that went away because the clot that had caused the temporary stroke moved on, and you were able to get your function back. You want to prevent a stroke, and there's some things you can do. Change your diet, lower your risk of salt and fats, eating more fish, eating foods that don't have a lot of added sugar, uh, eat more vegetables, more dry beans, whole grains, exercise. Try to exercise 30 minutes a day, at least 5 days a week. If you smoke, stop smoking. If you are drinking, try to drink, for women, one drink a day, men, 2 drinks a day. Take your medication as prescribed. And I trust in the Lord. I pray a lot. Can't get past prayer. God can help you through anything. And the African Americans have a much higher risk of having a stroke than Caucasians. And we need all the help we can get. I wish everybody well, and thank you for listening to me tonight. And you ain't got them. I think Deborah's frozen. Okay.
me this club thing. I don't have enough bones to feed that.
Mir, we still on?